All right, so this is going to be my informative speech. Here is my audience. I have my mom, my sister, my sister's friend, my dad, and then my brother is over there on the couch. He is awake. All right. All right, imagine you are a patient, you get a skin infection, and you go to the doctor's office just so you can get a regular antibiotic cream. Doctor prescribes you Bactroban, or commonly known as Bupiricin ointment. He tells you simple instructions: apply it to the affected area twice a day for 10 days. Simple enough. You go home, you start the therapy. After like 2 or 3 days, you notice your rash is gone. No symptoms whatsoever. You think, well, okay. And you stop using the cream. However, in a couple of days, that infection roars back. It's stronger than ever. And you're like, oh no. So you apply the rest of the cream, but now the cream is not working. You use the rest of the cream, but the rash is still prevalent, and you go back to your doctor's office to find some answers. Because you didn't use the antibiotic cream correctly, that bacteria actually grew stronger and became resistant to that medicine, making that medicine pointless. That is what antimicrobial resistance is. What is antimicrobial resistance? It is the ability of microbes to resist the effects of drugs, specifically antibiotics in this instance. We, not only in this country, but humans in general all over the world, misuse antibiotics daily. We depend on them just to fight off the simplest of infections, whether they're viral or bacterial, and because of that, now these medicines are becoming less effective. Antimicrobial resistance is an issue that has developed rapidly over the years and has negatively impacted modern medicine and can be a devastating factor for the future of public health as we know it. I'm here just to inform you a little bit about antimicrobial resistance, what it's about, how it spreads, how it affects modern medicine today, and what can we expect in the future. So how does it occur? Simply using antibiotics builds bacterial resistance. You take the drug. The drug kills the bacteria inside of you, not only good and bad, but it doesn't get quite all of it. The remaining bacteria become very strong. It becomes resistant to that medicine, and then it multiplies and grows. And it moves not only from you, but to anyone you get in contact with. According to a CDC survey a couple of years ago, 2,049,442 people in the U.S. are infected with a bacterial resistant infection. And of that number, 23,000 people die. It's not a statistic you hear about. It gets bogged under all the other media attention, but it is a serious issue that we're not paying attention to. Here's a little chart. It shows you, also from the CDC website, it shows you also how animals can also inhibit the use of these bacterial infections. You eat these animals: chicken, beef, any food animal that's grown in the U.S. is injected with antibiotics by these farmers to help their growth. They use them that way the animals don't die of sickness, but they also make the animals grow bigger. So imagine, profits soar with this, but they don't think about the repercussions. We eat these meats, and the bacteria that's left over in the meat, if we don't cook it properly or if it's not handled properly, we ingest it and now it's inside of us. So whatever antibiotic those animals are resistant to, now the bacteria is inside us, and then now we have that resistance in us as well. Also, on the other side, you just have the regular process of how it spreads. Someone takes an antibiotic, they either go to a hospital or some other primary care physician's office, and that spreads throughout that office. They go home, they go out and do the daily things that they normally do. It spreads then. Hospitals and nursing homes, people inside those patients inside those places are more susceptible to these diseases, and they succumb easily because their immune system is already down. They're old, they're on their way out anyway, their bodies can't handle these types of infections. Also in the hospitals, you have people that are already suffering from other illnesses. They're weak as it is. So if you have an infection that can't be treated with antibiotics, most likely these patients are going to succumb. How is it affecting modern medicine today? Bacteria grow stronger. The antibiotics that we currently have are being less effective. Many of the untreatable are found in hospitals and nursing homes, as I've already discussed, and that's where these bacteria thrive. Many contract these diseases as secondary infections to their primary. Most common example is the flu. Flu is a viral infection. You get it during the fall. There really isn't anything you can do about it except take medications to battle the symptoms, like Tamiflu. But while you're battling this infection, you can contract another disease. Most likely it's going to be pneumonia. Pneumonia is a bacterial disease. It can be potentially fatal if not treated properly. That you use levofloxacin for that disease. That antibiotic, if not used correctly, is less effective against that disease, and you could possibly die. For another example, methicillin is an antibiotic that has been a modified version of penicillin. It was created back in the 1960s to fight the 60% of penicillin-resistant staphylococcus, commonly known as staph infection. Dr. Leslie Prey, a doctor who works for the Nature Education Foundation, in a research paper that she wrote, it says, according to the CDC website, in 2004, 63% of all reported staph infections were caused by MRSA, which is methicillin-resistant Staphylococcus aureus. That's a 300% increase in the past 10 years, and past 10 time frame, because in 1995, 22% of all the reported staph infections were caused by MRSA. And 10 years prior to that, it was only 2%. So you can see that this bacteria is rapidly getting stronger, quicker than we can get the antibiotics out to the public. Here's a brief timeline. Here on this side, you have all of the medications, antibiotics specifically, that have been introduced. Penicillin back in the 40s, methicillin here in the 60s. What I want to direct your attention to is levofloxacin. That was introduced in 1996. That medication is used to battle pneumococcus, which is a bacteria that leads to pneumonia. That same year, reports were found of levofloxacin-resistant pneumococcus bacteria. Within the same year, possibly months, this bacteria had grown resistant enough to cause a problem. Now, what does the future hold? What does this mean for the rest of us? Research is lacking for novel antibiotics. There's not too many people in the field. They don't have the resources they need to find new medicines to battle these resistant bacterial infections. Between 2008 and 2012, the FDA has only approved 3 new antibiotics. That's not going to cut it, frankly. We need more medicine to get out in order to battle these infections. Current antibiotics will be rendered obsolete unless we take them properly. Resistance grows anyway as you take the antibiotics. But if you abuse them, this causes the bacteria, it causes the process to go faster. There are simple ways to try and slow down the resistance building process. Number 1, do not take pills that aren't yours. If you get sick, don't go to the medicine cabinet and pull a bottle out of old medication back from 2005. That medication, not only is it old, it can cause harm to yourself. It can also cause the sickness inside you to become too resistant to that medication, which it shouldn't even have contact with it in the first place. Number 2, antibiotics aren't used for everything. They target specific infections. They're made to target specific infections. So do not take medication that's not particularly prescribed by your physician. Number 3, do not save leftovers for later. You must finish the therapy from start to finish. If your doctor prescribes you cephalexin, take 2 a day for 10 days, that is exactly what you do. But at the end of the therapy, if you're not feeling any better, by all means go back to the doctor. However, do not let that sickness linger inside of you, because that's how it gets stronger. And lastly, physicians should prescribe the antibiotics judiciously. They shouldn't just hand it out to any patient that demands it. You have to use these medications wisely. You cannot just take them for everything. So I've told you a little bit about antimicrobial resistance. I've explained to you what it is, how it spreads, not only in the US, but how it can also spread throughout in the world globally. I've also told you how it affects modern medicine today. Hopefully you have a better idea about what it is, and keep that problem in the back of your mind as we move forward in this problem. Hopefully we can solve this, together if we just use these antibiotics correctly. It shouldn't be a major problem in the future if we can just do that.